So now, I am going to introduce myself to my patient. Good morning, ma'am. I am Riabel Standarticinco, under student from Asian College of Technology. I am going to assess you from day shift. So for safety purposes, ma'am, may I hold your hand to check your ID band? What's your name, please?
Rebecca.
And your age?
Show.
And your date of birth?
October 17, 2009.
Okay. I am here to assess your skin, to assess your hair, your mouth, your sinuses, your eyes, and more. So, before I am going to start, I am going to perform hand hygiene. And the next thing that I am going to do, I am going to wear my gloves. As you can see, I am done wearing my gloves. So, the next thing that I am going to do, I am going to provide for my client privacy. So, I already closed the door. I already closed the curtains to provide privacy to my client here. So, the next thing that I am going to do, I am going to assess the general appearance and behavior of my patient. Note, appearance, behavior, and grooming. So, as I observe her, normal findings, patient is well grown, patient is behave according to her age. So the next thing that I am going to do, I am going to inspect the skin color of my patient, the uniformity of the skin color. If edema is present, I am going to assess. I am going to look for location, the color, temperature, degree of indentation. So okay. And the next thing that I am going to do, I am going to palpate the skin temperature comparing the bilateral parts. Note for skin trigger. I'm going to check the skin temperature. Normal findings varies from light to deep brown, from ruddy pink to light pink, generally uniform in color except in areas exposed to the sun, areas of light pigmentation of palms, lips, nails, beads in dark skin people. So for skin, in a dehydrated patient, skin is dry, loose, and wrinkled. Elevated body temperature may result in increased perspiration. These techniques provides information about the patient's hydration status as well as mobility and elasticity of the skin. Decreased elasticity may be present in dehydrated patients. Edema may be a result of overhydration, heart failure, kidney dysfunction, or peripheral vascular disease. So for palpation, ablations may result in drainage, which provides clues to the type or cause of the lesion. Gloves prevent contact with blood and body fluids. So now I am going to assess the head of my patient. I am going to inspect for size, for shape, and for symmetry. I am also going to palpate for texture and consistency. Do you feel any pain, ma'am?
No.
What about here? So normal finding. As I inspect my patient's head, proportional to the size of the body, round with prominence in the frontal area, anteriorly and the occipital area, posteriorly symmetrical in all planes, gently curved, normally hard and smooth without lesion. So now I am going to inspect and observe her scalp. I am going to observe for lumps, scars, nits, dandruff, and lesions. So normal findings as I inspect her scalp: clean, free from masses, lumps, scars, nits, dandruff, and lesion. So as I inspect the scalp of my patient, hair should be evenly distributed over the scalp. There are variation in hair color. The scalp should feel mobile and non-tender. So now I am going to inspect the hair of my patient. I am going to note for color, texture, odor, and I am going to inspect for presence of infestation or infection by parting the hair in several areas, checking behind the ears and along the hairline. So, as I inspect my patient's hair, normal findings: black in color, evenly distributed, thin, silky smooth, no infestation or infection, no flaking, lice, or nits. So, for hair condition, it provides information about nutritional and oxygenation status. So now I am going to inspect the appearance of the face, the symmetry, expression, and movement. I am going to palpate also the maxillary sinuses for tenderness. Can you please smile for me, ma'am? Can you please move up and down your eyebrows? Okay. Just steady, please. I'm going to palpate your maxillary sinuses. Do you feel any pain?
No.
Okay. So normal finding. As I inspect her face, rounded, free from wrinkles, proportionate and symmetric, movements are equal bilaterally, no tenderness over maxillary sinuses. So generally, the shape of the head is normocephalic and symmetric. Abnormal findings include a lack of symmetry or unusual size or contour of the head, which may be a result of trauma or disease. Facial expression is appropriate. Skull should be mobile and non-tender. So now I am going to assess the eyes, not for position, color, movement. I am going to inspect the eyeballs, palpebral features, and lid margins. So normal finding as I inspect her eyes, black in color, symmetric in shape and movement, no protrusion of eyeballs, palpebral feature appear equal in size when eyes are open. Upper lid covers small portions of iris and cornea. Lower lid margin is just below the junction of the cornea and sclera. No ptosis. So for eyes inspection, detects abnormalities such as ptosis, styes, conjunctivitis, or scleral color. Some abnormalities are associated with systemic disorders. So now I am going to inspect the eyelashes, note for position and distribution. So normal findings as I inspect, black in color, evenly distributed and parallel to each other, curled outward. So I am going to inspect the eyelids, note for placement, swelling, lesion, presence of discharge. So normal findings as I inspect her eyelids, no swelling or discharge or lesion. Now I am going to inspect her lid margin. Note for placement and consistency, tenderness, presence of lesion. Normal findings as I inspect her lid margin, clear, without scaling and lesions. Lacrimal duct openings are evident at the nasal ends of the upper and lower eyelids. So now I am going to inspect her lower palpebral conjunctiva and lacrimal glands. I am going to note for color and consistency. So normal findings as I inspect, pink in color and clear. So now I am going to inspect my patient's sclera of the eye. I am going to note for the color and consistency. So normal finding as I inspect, white in color and clear. Now I am going to inspect the iris, color of the iris, the size, and the symmetry. So normal findings as I inspect, proportional to the size of the eye, round, brown, and symmetrical. So now I am going to assess the pupil. Note for size, shape, color, reaction, and accommodation. So I am going to assess with lights on. And also, I am going to assess with lights off. Now, I am going to assess the pupillary response in contraction and convergence when focusing on a near object. So, normal finding, as I inspect, pupil equal round and reactive to light and accommodation from pinpoint to almost size of the iris, round, symmetrical. So now I am going to assess the eye movement. Note for movement of both eyes in the 6 cardinal position of gaze. Focus on this, ma'am. So normal findings as I inspect, and she can able to move in all direction, 6 cardinal position, eyes move in conjugate fashion. So presence of the red reflex indicates that the cornea, anterior chamber, and lens are free of opacity and clouding. I am going to assess the visual acuity. I am going to test the acuity using the Snellen chart, 20 feet distance.
D, F, N, P, T, X, Z, U, Z, D, T, F, D, F, N, P, T, H, P, H, U, N, T, D, Z, N, P, X, T, Z, F.
Again.
D, F, N, P, T, X, Z, U, Z, D, T, F, D, F, N, P, T, H, P, H, U, N, T, D, Z, N, P, X, T, Z, F.
Okay, very good. So I already test her vision using the Snellen chart. Normal findings, inspection 2020, normal vision. This testing evaluates the patient's distant vision and function of cranial nerve 2. Additional tools are used to test for color perception. So at this moment, I am going to assess the ears. Note for placement, size, shape, color, presence of lesion or masses. To the other hand. Now I am going to palpate the auricular cartilage of the patient, the tenderness, the consistency of the cartilage, or swelling. Do you feel any pain as I touch it?
No.
To the other side. Okay. Normal findings as I inspect and palpate my patient's cartilage. Parallel, symmetrical, proportional to the size of the head, palpation, firm cartilage. Now I am going to assess the ear canal. I am going to inspect external canal and tympanic membrane using otoscope, but I don't have otoscope. I am just going to use a pin light. I am going to check for cerumen, inflammation, lesions, masses, or foreign body, presence of pus or blood. Inspect tympanic membrane for color. Can you please here? So normal findings as I inspect my patient's ear canal. Distal third contains hair follicles and glands, pale, clear, with scant amount of cerumen and few cilia. Dry cerumen, grayish tar color and sticky, with cerumen in various shade of brown. The ear canal should be smooth and pinkish, and the tympanic membrane intact, shiny, and fairly gray with no bulging. Redness, discharge, and perforation of the tympanic membrane are all abnormal. So now I am going to assess hearing acuity to my patient. I am going to perform whisper test.
Hearing acuity. Hearing acuity.
Okay. Now I am going to use a Weber test on my patient. I'm going to ping the tuning fork, ma'am, and tell me where you hear the sounds, okay?
In the middle.
Okay. So, I already assessed the lateralization or vibration and conduction of hearing acuity. So, normal findings, as I inspect, able to hear whispered words 2 feet away. Weber test, vibration heard equally well in both ears. So, this testing provides a gross assessment of cranial nerve, acoustic nerve, using a tuning fork to perform Weber's test if the patient reports diminished hearing in either ear. These tests help to differentiate conductive from sensorineural hearing loss. So now I am going to assess the nasal. Note for nasal color, shape, consistency, patency, tenderness. So normal findings as I inspect my patient nasal, midline, symmetrical, and patent. These actions assess for the color, shape, consistency, and tenderness of the nose. So as I inspect for internal NARES, note color, moisture, presence of exudates. Normal findings as I inspect my patient. Mucosa is dark pink, moist and free of exudates. This technique can detect edema, inflammation, and excessive drainage. So for nasal septum, as I also check the placement, presence of discharge, normal findings of inspection the nasal septum of my patient, straight, intact, and free of all sorts of perforations. So I am going to assess the mouth. I am going to inspect the lips color, lip condition, presence of lesions. So normal findings as I inspect her lips appears pink and moist, no lesions noted. This technique evaluates the condition of the oral structures and hydration level of the patient. I'm going to inspect the gums. I am going to observe the color, consistency, and conditions. Open your mouth. Normal finding as I inspect my patient gums appears pink and moist. Color and consistency along gums are even. No lesions noted. So I am going to assess the teeth. I am going to check the number of teeth, color, and condition. Not for any repairs. Open your mouth, please. So normal findings, inspection, 32 pearly whitish teeth and smooth surfaces and edges. No missing areas or carriers. Now I am going to inspect the tongue color, moisture, texture, and size. I am going to check for midline position or protrusion. I am going to palpate also for lesions or hardness. Can you please open your mouth and... Okay. So normal findings as I inspect my patient's tongue, pink, moist, moderate size with papillae. Tongue is midline, no deviations noted, no lesions noted. So sticking out the tongue evaluates the functions of cranial nerve. Saying a checks for movement of the uvula and soft palate. I am going to check the frenulum position, tongue motion. Normal findings as I inspect the frenulum, straight, 10, and midline. I am going to inspect the buccal mucosa. I am going to check for color and consistency. findings as I inspect: pink in color, smooth and moist without lesions. I'm going to inspect the palates and uvula. I am going to inspect hard and soft palates for color, shape, texture, and the presence of bony prominences. For uvula, I am going to inspect the uvula for position and mobility while examining the palates. I am going to ask my client to say ah so the soft palate rises. See ah.
Ah.
So normal findings as I check my client's palates and uvula. Soft palate is light pink and smooth. Lighter pink hard palate, more irregular texture. Uvula is positioned in midline of soft palate. Now I'm going to assess voice. I am going to check the voice quality. Can you please state, ma'am?
To check voice quality.
So normal finding as I inspect her voice, no hoarseness and well modulated. Going to assess the neck. Check for position, symmetry, and note for swelling, lumps, and masses. Okay, so normal findings as I inspect my patient's neck: symmetry, straight with head proportional to the size of the body, centered without bulging masses, palpation, no palpable lumps, masses, or areas of tenderness. I am going to assess the range of motion of the neck and the muscle strength. I am going to check the range of motion, and I am going to determine strength of the sternocleidomastoid muscle and the trapezius muscle. So please do perform it. Okay. So normal findings as I inspect: freely movable without difficulty, symmetrical, force applied in the sternocleidomastoid and trapezius muscles are resisted. So now I am done assessing my patient hair, skin, nasal, mouth, and neck, and more. So now, because I am done, I am going to remove my gloves and any additional PPE I've used. And I am going to perform hand hygiene. So removing PPE properly reduces the risk for infection, transmission, and contamination of the other items. Hand hygiene prevents the spread of microorganisms. Assessment should be completed as indicated to evaluate the patient's health status. Intervention by other healthcare providers may be indicated to evaluate and treat the patient's health status.